Hello, I'm Dr. Sandra Fryhofer, liaison to ACIP, the CDC's Advisory Committee on Immunization Practices. Welcome to the American College of Physicians 2022 Adult Immunization Video Series. The topic, flu vaccine update for 2022. What flu vaccines are available and who's most at risk of flu-related complications? During last year's flu season, the one for 2020-21, we lucked out. Flu activity was unusually low, almost non-existent in the US and globally. A record number of flu vaccine doses, more than 190 million, were distributed. Face masks, hand washing, physically distancing, and staying home also likely had a role. Yes, there was COVID, but we managed to dodge a twindemic. That was then, this is now. COVID's still here, and on December 28th, 2021, in the midst of the Omicron surge, CDC posted this warning urging flu vaccination. Flu season started, flu hospitalizations are on the rise, cases of co-infection have been reported in the US and abroad. Your best protection is vaccination. And there are several types of flu vaccines to choose from. All flu vaccines are not the same. Formulations may vary by production method, egg-based versus egg-free, new technology, and whether an adjuvant's been added. Different age range indications often apply. Method of administration can be as a shot or needle-free, by jet injector or nasal spray. Vaccine antigen doses range from standard to high dose. Vaccine virus strains can be inactivated or live. There are many differences, but all flu vaccines available in the US have this in common. They're all quadrivalent, meaning they protect against 4 flu strains, 2 flu A's and 2 flu B's. The older trivalent versions, which covered only 3 flu strains, are now history. Let's start with the classic. The standard dose inactivated influenza vaccine, abbreviated SDIIV. It's made from killed virus that's been grown in eggs. Several companies make them. Standard dose shots with a needle can be given to adults of all ages. The needleless jet injector versions only for younger adults 18 to 64. Growing flu viruses in eggs can introduce egg-adapted changes, which can lead to differences between viruses grown for the vaccine and viruses that are circulating. This can mean antibodies triggered by the vaccine may be less effective. Cell culture-based inactivated influenza vaccines, abbreviated CCIIV, avoid this hurdle. Its vaccine viruses are grown in cell culture instead of chicken eggs, so those egg-adaptive changes don't apply. There's only one CCIIV available in the US, brand name Flucelvax. This egg-free option can be given to adults of all ages. Next up, another egg-free new technology formulation, RIV, the recombinant influenza vaccine. It's also a one-of-a-kind in its category, sold in the US under brand name Flublok. It's only for those 18 and older. It should not be given to anyone who's younger. Recombinant vaccines do not require candidate vaccine virus in order to produce them. The flu virus antigens are created synthetically. Its HA antigen is produced using recombinant methods without viruses or eggs. RIV has triple the antigen dose, 45 micrograms per vaccine virus strain, as compared to a standard dose of 15. As people get older, their immune systems don't work as well. These next 2 vaccines are only for those 65 and older and are specially designed to improve immune response. One adds an adjuvant, the other has quadruple the antigen dose punch. Both are inactivated and egg-based. The only adjuvanted influenza vaccine currently available in the US is abbreviated AIIV, brand name Fluad. The secret of its extra boost is a lipid and water adjuvant M59. The only high-dose flu shot, HDIIV, brand name Fluzone High Dose, has 4 times the standard dose of antigen, 60 micrograms per vaccine virus versus the standard 15. The upside for adjuvanted and high dose is their ability to induce a stronger immune response. The downside for both is more side effects as compared to standard dose inactivated vaccines. And last but not least, LAIV, the live attenuated influenza vaccine, aka the nasal flu vaccine, brand name FluMist. It's recommended only for young, non-pregnant adults under 50. Its big advantage, it's needle-free. LAIV is also egg-based. It's made from live but weakened virus, so it can be given to pregnant women. It also should not be given to those with underlying medical conditions, including heart, lung, liver, kidney, neurologic, hematologic, or metabolic disorders, including diabetes. It's only for healthy, non-pregnant people age 2 through age 49. It's contraindicated for those with immunocompromising conditions, cochlear implants, or any type of cranial CSF leak. Check CDC's comprehensive list of LAIV contraindications and precautions for more details. So, what about people with egg allergy? What are their flu vaccine choices? People with egg allergy of any severity can receive any of the licensed, recommended, age-appropriate influenza vaccines. Even for vaccines grown in eggs, the amount of egg protein is minuscule. However, those with a history of severe egg allergy, meaning symptoms more severe than just hives, should be vaccinated in a medical setting supervised by a healthcare professional who's able to recognize and manage severe allergic reactions. Unless either egg-free CCIAV or egg-free RIV is the flu vaccine being administered. Who's at higher risk of flu complications? Adults 65 and older, as well as adults with chronic health conditions, including asthma, heart disease and stroke, diabetes and chronic kidney disease. People with a weakened immune system due to disease or medication are also at increased risk of serious complications from flu. Flu is more likely to cause severe illness in pregnant people than in people of reproductive age who are not pregnant. There's a large body of evidence supporting the safety of flu vaccine for pregnant people and their babies. Vaccination during pregnancy can also help protect baby from influenza at birth because protective antibodies are passed on to baby during pregnancy. Let's wrap up with some commonly asked questions. The first one's about timing. When's the best time to get your flu vaccination? If you vaccinate too early, immunity may not last through the entire flu season. In general, for non-pregnant adults, vaccinating too early in July and August should be avoided. However, for pregnant persons in their third trimester, vaccinating as soon as vaccine is available is okay. Vaccine should be offered by the end of October. Catch-up flu vaccination should continue throughout the season. Flu most commonly peaks in February and can last into May. A final question, and this one's a little tricky. Which vaccine does ACIP prefer? Here's the official word. For the 2021-2022 season, ACIP has no preferential recommendation for a specific flu vaccine when more than one licensed, recommended, and age-appropriate vaccine is available. But ACIP is in the process of conducting a systematic evidence review looking at vaccine efficacy of different formulations in older adults. Remember, everyone 6 months and older needs flu vaccination every year. Happy vaccinating. For the American College of Physicians, I'm Dr. Sandra Fryhofer.